not fun, but we're going to be blessed, and we're going to learn quite a bit in today's broadcast. So at this particular point, I want to request Dr. Arinda, I'm sure you watched the testimony of Deacon Taja and also the testimony of Pastor, of the pastors. What's your comment in the first place?
So I watched both the videos, or I should say the testimonies, and I was very glad that they shared their experience. And why? It's because, you see, when someone shares their experience, then it helps to normalize this issue that we call mental distress. Normalize in that sense, not that saying that it's normal, but normalize in the sense that there's someone else who has gone through the same experience, and that helps a great deal to deal with stigma. And we usually look at stigma in two ways. So we look at stigma as coming from outside, from the people outside to us. So it helps people outside to know that this can happen to an individual, and in case they come to seek for help, I'll be able to offer my help. And they help people to know that it's not an evil thing to feel distressed mentally. But also it helps to deal with what we call internal stigma or self-stigma. That stigma that when someone now gets symptoms or feelings of mental distress or of depression, they will not shy away from seeking for help in case they need it. They'll be encouraged knowing that someone else has gone through the same journey, and they'll be encouraged to fight on. So I see these as stories of victory, but I see this as a step forward in us promoting our mental health.
Thank you very much. And I would like now to ask Deacon Taja to tell us, after watching the Chimulis, what did you think?
Wow, thank you so much, Bishop and Dr. Arinda. It was really actually an honor. Thank you, the Chimulis. Your testimony really blessed me. I think for me, I was just encouraged in terms of that there are other people out there who have gone through this and have also overcome. And as we particularly are on this journey to create more awareness of mental health issues, it's really encouraging when other people out there who have experienced this and have overcome by the grace of God are able to share their testimonies, how they overcame. You know, Mrs. Chimuli was talking about how the time they told her go home and sit, and then the issue was, okay, now after I've recovered, what next, you know? And that encouragement of to get up, you know, I really like the example she used about the gentleman at the well, you know, get your mat and go, you know, once healing has come, deliverance has come, especially for us as believers, you know, there's that place or where you have to get the strength now to move on. So I really appreciated that, and especially in view of, like I had earlier shared, some people also were out there and had earlier reached out to me saying we are still struggling with this, or we have family members struggling with this. So I'm sure they were equally blessed by that testimony. Thank you so much.
Welcome. Now the Chimulis, I want to bring you on board. When you listen to the doctor and to the deacon, what did you think? And what feedback have you got from the people who watched you live?
Praise the Lord. It's good to be here once again. When I listened to Deacon Taja, first of all, even before I listened to her, I saw that on Facebook she had, you know, written an article about mask off. And then she went on to share. Like for me, that gave me courage of, you know what, actually mental health can happen. Anybody can have mental health challenges. Anybody. And on top of that, whether you've had mental challenges or not, you can still move on with your life. You can still, be what God has called you to be. You can still be successful. Because when I look at Deacon Taja, really for me, she's an inspiration. She's an example of, a woman whom, who is successful. So, when she comes in and says, man, I've also had this issue. For me, that is just like, you know what? Okay, people have issues, but I mean, they move on with their life and everything just gets back to normal and they succeed and they're able to use these stories to inspire so many people out there. Then when I watched the doctor, thank you so much, doctor, for sharing. I really liked, the aspect of you bringing in scriptures of, different examples of people who struggled with mental health issues in the Bible. I remember that time when I went to meet the psychiatrist. I only met the psychiatrist once, but also she was a Christian. And she was telling me, okay, if you have this issue, you see, there is David. David was a man like who struggled with ABCD, but every time he had an issue, he poured his heart out to God. He wrote psalms. And these are the psalms, that we keep referring back to here and then, for encouragement. So she was telling me you can use what you have to encourage so many people. And so I really want to appreciate the doctor that, she was just showing us these examples from the Bible, and really that made us relate. Then feedback from the public. Already, like today, I've had so many people, contacting me, calling me and saying, thank you so much, for stepping out. Thank you so much, for encouraging us. Thank you so much, for just speaking out. But, one tangible example that I can really give is that today I had a friend of mine, forwarding me a name and saying, Doreen, you know what? I need to forward you this person. She's in the village. She has been in ministry for 8 years. She has not received a breakthrough. She has, been waiting. She has given up on life. In other words, she's downcast. She went back to the village. And my friend was telling me, Doreen, when I was praying and thinking about this person I was given to follow up, I just thought of you. And I know that you can reach out to her. And I was telling her, yes, I've been there. I've experienced all that. And I can talk to this person, and it is possible, to just get through these things.
So it's been nice. Yes, Pastor.
Yes, it's been wonderful.
Yes, Bishop, as for me, when I was listening to Doctor and Mrs. Spencer, it was just taking me back to the experience I went through. Because I visited the psychiatrist for over a year and a half, and the questions she was raising, that they were asking you hear voices, they were the same questions as being asked, and a whole list of symptoms, which I was also just laughing at. But I thank God, when I listened to the testimony, I was encouraged. And today I also had people sending me messages, like, thank you very much. One actually was asking me how exactly to go about their situation in terms of, forgiving themselves. And I was having a chat with them, and I was telling them, you know what, forgiving yourself, you give yourself a favor, and it helps you heal. It helps you to move on. And I was just thinking, like, the fact that you learn to forgive yourself, it's also an easier way of accepting the love of God. Some people also struggle with that. They struggle to actually believe that they are loved and they are worth something. They are worth a lot to God. So while I was chatting with this person, I was like, yes, encouraging them. I said, it is very possible to forgive yourself and you're much freer. Yes, for sure. Wow.
Well, the first question that I want to ask, by the way, members of the audience, feel free to post your question here, then the experts will get to answer it. But I want to ask the first question, and it goes straight to the doctor. We have noticed that people who are in advanced stages of HIV sickness, develop a kind of a mental problem. And yeah, that's the question. So how should they deal with that, given the fact that they're already dealing with all these medications? What's the main cause and how should they deal with it? Because for them, it's their special case.
Thank you, Bishop, for that question. That is a wonderful question because I actually do work in an HIV clinic in Mildmay, Uganda. And mental illness is very common in HIV. So there are so many things that may cause mental health problems. So it could be biological. It could be that the virus, if not treated early, can travel to the brain and cause issues, and people get mental illness. But in addition, sometimes people with HIV get other illnesses, what we call opportunistic infections, infections of the brain that can cause mental illness. But also sometimes the medications we give for HIV, the ARVs, can cause the mental illness. However, some mental illnesses come up because of social issues, because of stigma. Some people are still in denial. Some people are rejected by their families because of HIV. So all these issues may cause mental illness in HIV. So when we are looking at someone with HIV, you have to decide what causes the mental illness, because that will determine what kind of treatment you give. So for HIV, depending on how severe the symptoms are and what kind of mental illness it is, sometimes we have to give medication. But sometimes if there are social issues, let's say stigma or poverty or rejection by family, then we can deal with that with just counseling. So HIV is rather complicated and complicates mental illness, but it's a good thing that you've brought it up because it's important that we deal with mental illness in HIV early, because it can affect the way they receive their treatment for HIV. For example, I've seen a number of people when they get depressed in HIV, then they will say, I no longer want to take my medicine, and then it will even worsen the HIV. So it's important that we pick these things up early so that at least we treat them and keep the person on course for their medicine for HIV, because most likely HIV will kill them even before the mental illness. So it's important we deal with mental illness so that they continue their ARV medication.
Okay, in both cases of the testimonies we had, we were told, the people told us, the brethren shared with us that there was something to do with their esteem, especially the couple. They told us about self-esteem as one of the problems that they encountered. Now, would you categorize self-esteem as part of mental sickness? Doctor.
So, self-esteem in itself, you won't say someone with low self-esteem has a mental illness if it just comes alone. It could be a personality issue, as I said previously, but it's very common for people with depression or with some forms of anxiety to have low self-esteem. And what is worse, so what makes it a symptom in depression is that it even goes to the point of someone thinking, I'm worthless, I'm not good enough, I can't do anything that's worth it. So in depression, the low self-esteem is even worse than for someone who has a personality issue of low self-esteem. And it has been shown that people with low self-esteem are actually at a higher risk of getting depression. So it's important, if you just have low self-esteem, there are some activities that you can do to build up that esteem so that you don't get to the point of depression.
Okay, and now we have this issue of comfort food. when people get depressed. Okay, me, sometimes when I really feel, I wouldn't categorize myself as someone who gets depressed, but when I feel low, there are times when I feel low, and usually after great victories, I've hit an anticlimax or something like that. I tend to look for certain things. In the past, I used to eat a lot of pork. So when I would hit the victory and look for pork, or I would go and buy a cake at Serena or at Sheraton. So it was more to do with every time I wasn't feeling well in my mind, not in my mind, when I would be not feeling well in my heart or in my emotions, I would end up eating. Yeah. But that also later I realized had become a kind of routine. When I'm not feeling so well, when I'm feeling low, I look for comfort foods. And if I keep feeling bad for several days, when I eat it for some time, I feel good and I get off it. But I go to a time when I was not feeling good in a protracted period of time. Yeah. So how should we deal with that kind of situation?
So thank you for that question. So eating, so as I said, one of the symptoms of depression actually can be either someone refusing to eat, under eating, or overeating. So there are, if I could go a bit back on that question, there are so many things that so many theories. We may not be able to really explain why people overeat when they are low, but there are some theories that we can put in place. So in our brain, we have a system, that what we call the reward system. So this is a system, when it's activated, you feel happy. So it's the same. So usually when you eat a piece of, let's say cake, let's say if you love cake and you eat a piece of cake, or if you love ice cream and you take ice cream, what makes you happy is that that system in the brain will light up, and then you feel happy for some time. The same system that lights up when when anything pleasurable happens. It's actually even the same system that works for people who are addicted to drugs. So when you take a drug, that system lights up. So what happens is that, so when we eat food, especially when you're stressed, then that system will light up. You'll get some form of pleasure. You'll be happy in some sense. So that's why some people end up eating. And you realize they don't eat things that, cassava, matoke. They'll eat something that they love eating, things that are sweet, things that are fatty, because these are the things that they like. So it's an attempt to get some pleasure, especially when you're depressed or when you're feeling low necessary. So that's how the food that we eat, those comfort foods that we eat, light up that system. And that's how some people end up addicted to eating food when they feel stressed. So what we can do about that is that instead, when you find that you're low, find some activities that may not necessarily affect your health negatively. So studies have actually shown doing exercise when you're feeling low can help. It's just that it's hard for you to start doing an exercise when you're feeling depressed. But doing an exercise, maybe reading a book that you like, listening to music. So we have to look for those activities that will light up that system, but they do not necessarily cause any harm to our bodies. So this is something that we need to think about. And another thing that I would want to briefly talk about this for us to take, especially people that are parents or us who hope to be parents soon, this thing starts from childhood. So we have to make sure that even as we are raising children, we do not raise them that every time they are sad, when a child comes from school, they are sad, you give them a piece of cake, you give them chocolate. So their brain will be wired in that way, that every time I get sad, I eat something nice. So try not to do that a lot for them as they are young. because that habit gets reinforced, and when they grow older, they will lean towards eating food to deal with stressful situations. Thank you.
Thank you very much. I would like to ask Deacon Taja, do you have any question for the doctor?
Right now, nothing comes to my mind. Maybe as we go along.
Also the other pastor. Nothing comes along right now. Okay, Chimulis. Chimulis, do you have any question for the doctor or to Deacon Taja?
Okay, not any question right now.
Okay.
Oh,
so
actually,
one of the
Bishop.
Yes.
Yes, sorry. Is something just actually came to my mind as I was recalling my experience, particularly as we try to help assist my brother go through depression. So I was just wondering, for instance, like my brother, at some point they said he had schizophrenia. At another point they said he had bipolar. There was no clarity, or I would say maybe different specialists were giving sort of like different diagnoses concerning his health. So it was a bit confusing for us because we went to different places, and somebody would say, oh, I went to this doctor, this is what they said. They said, no, that cannot be bipolar. It's most likely schizophrenia. You go to this other and they say, no, that can't be schizophrenia. So I don't know, maybe is it that there's still a lot of uncertainty surrounding these issues? What could you say around that? Thank you.
Thank you, Deacon Taja, for that question. So to answer that question, you're partly right about the uncertainty. So mental health is still a developing field. You realize when we're making diagnoses, I don't know if you've been able to see a psychiatrist before, or even for those who haven't seen one. Usually when we're making diagnoses, for us to say you have depression, we don't do any particular test. It's what you tell us that helps us make the diagnosis. So that's the issue. You know, for malaria, I will just take off your blood and go see under microscope, see the parasites, say malaria. HIV, they do a test, positive, you have HIV, negative, you don't. So that's what is not clear about mental health. We don't have a particular test we do, and we say you have this and this. So we depend on what you tell us. And sometimes the illnesses, so the symptoms may be a bit the same. So you'll find, for example, schizophrenia is one of the serious mental illnesses, and it's mainly characterized by either someone hearing voices that they are not there, or seeing things that are not there. So issues like that, so believing things that are, out of this world, they don't align with religion, they don't align with politics, so things that are bizarre and out of this world. And then, but then you also find that bipolar patients may also have voices, but then they are a bit different. So it somehow, I understand it can be really frustrating, especially for the patients or their caretakers. So what I would advise for that is that usually if you find one clinician, one psychiatrist, one psychologist that you trust, stick with that person as long as they are helping you. So along the way, the diagnosis may change, but obviously, I hope that we as the psychiatrists, so the psychologists, are taking time to explain to the people we are treating. But that happens once in a while. But to reduce the anxiety, it's better that you stick with one doctor that you trust, one doctor, so that even having to switch between different doctors may confuse you more. But then when you stick with one person, you'll be able to go through this journey, so that even if they look at your symptoms along the way. For example, let me just give an example of bipolar. Bipolar disorder is a disorder that has mood. It's what we call a mood disorder. So some episodes you're depressed, typical depression as you all told us. But then you find that there is a moment where you have your mood is up, you're talkative, you can't sleep, you're on a high. So maybe the first time you see the doctor, you may be depressed and they will say you have depression. But next time when you come with a high, they'll be like, no, now it's bipolar. So there may be those changes, but to just deal with that anxiety, get one doctor that you can stick with, who will go with you through the whole process of managing the mental health problem.
Thank you very much. Now we have a few questions. Okay, one of them says, I recently had a condition called burnout. How different is it from depression? And is it possible to go through these conditions and heal without even knowing that you were ill before? Mark Cadigo in Brussels. Do you cover burnout?
Yes. So burnout is actually one of those things that I like, because it's a topic that is common actually in the medical field. I don't know whether it has really spread to the other occupations.
Yes,
but it's something that
we have it among pastors. We have it among pastors. I've suffered maybe 2 burnouts in the past.
So usually everyone who works is at a risk of burnout. Even just as a mother taking care of children, you can get burnt out. So burnout basically is when we usually use it for people that are working for some sort of functioning. When you find that you're no longer functioning optimally because of the stresses that come with work. It's not synonymous with depression. Usually burnout, you're able to function, but you function at a lower level than you expected to function. And usually the symptoms all come as a result of the work that you're doing. If you're a pastor, taking care of the church members. If you're a mother, taking care of the kids and the family generally. If you're a teacher, teaching. So usually those symptoms come due to the work that we are doing. And importantly, actually, it's one of the things that we keep teaching, because now for us, we really take it seriously as doctors and health workers, because we realize that when a health worker is burnt out, they are more likely to make mistakes, which can even cost a patient's life. So we take it very seriously. So very important is self-care. So if you want to deal with burnout, practice self-care. We give ourselves selflessly to help people and forget ourselves. And we forget that if I'm not at my best, I am not going to serve people at their best. So self-care, basic things, exercise, make sure you have your meals a day. If there are 3, make sure you spare time to have your meals a day. Make sure you get rest. So the way to deal with burnout is self-care. But it's necessary with depression.
Thank you. There is another question here. Can overreading or studying also be depression? And what's the cause of mental illnesses in most students doing science at A levels?
So thanks for that question. Overreading. So overreading is not a sign of depression, Patty. So I can't say people who overread are depressed. So it depends. But sometimes people overread because they could be worried about the exams. So some people may overread because of anxiety. But then the overreading, especially in students, is commonly a sign of bipolar disorder. So let me just briefly try to talk about bipolar disorder, because this is one of the illnesses you'll hear. So bipolar disorder is a mood disorder, whereby someone, as you hear bipolar, there are 2 poles. So at some point you may be depressed, typical depression, and then at another point you may be what we call manic. So your mood is elevated, you're overly happy, some people are even aggressive, you can't settle down, you're up and down. So this is a kind of person who works from morning to evening without getting tired at all. They cannot sleep. I don't know. So usually these are the serious mental illnesses. Bipolar is one of those serious mental illnesses. Someone who will be shouting. So some people start shouting all over the place. And in some students, one of the symptoms is overreading. So this is someone who will read from morning till evening without, getting tired per se. So I cannot say that overreading is a symptom of anything. I cannot say, but if you see someone overreading and it's beyond normal, you can see a clinician, or you can just ask them if they have any other symptoms. You look for other symptoms. Are they over talking more than normal? Are they, talking to themselves? Things like that. Or are they not eating? So you tie up the symptoms and then say either they have a mental illness or they are just being serious about their books. So
Okay, thank you. Thank you, doctor. We have another question. How do you deal with someone who has done something wrong, and when you try to help him, he reacts violently or the tempers flare up?
Thanks for that question. Maybe also my colleagues will try to answer that. But what I can say about violent behavior, first of all, if someone is already not calm, do not try to bring up the issues. First, wait for someone to calm down, and then you can bring up the issue that you want to talk to. So don't get someone who is already angry and try to talk to them. They will not answer well. But also what is very important in violence is what we call, because in our field we have to work with quite a number of violent people, is what we call verbal escalation. So the way you speak to someone is what will either increase their violence or reduce it. That's why I say usually when you're speaking to a violent person, try to see that you calm them down. If they can take a seat, if possible, postpone the conversation to later when they are a bit much calmer. If they are not, then if you see that even at a later point, when you bring up the topic, they are not able to relax, you can call in someone else that they respect, and you have the conversation, the three of you, so that in case they decide to get violent, at least you're not alone with them. Or if they respect the other party, then they may keep their tempers down.
Okay.
But my colleagues can.
Before that we turn to them, there's a lady who said she has, okay, maybe they can deal with this. She says she has done everything possible, everything according to the book, but she is still depressed. What do you tell her? How do you help her?
I don't know what everything according to the book means, but usually when we are managing depression, so depending on it depends, first of all, it could depend on the person's preference. So some people may prefer counseling or before medication, but also how serious the illness is. So I do not know what that person means by everything in the book. So I may not be able to judge that. But if you see what you're doing is not working, then you may need to either try something else, or sometimes you may not be able to solve the problem on your own. So if you've done everything according to your power, then look for someone else, someone who has gone through the same situation, someone you think you trust, someone you trust, someone that you know can help you. Seek out help from someone else. So when you feel overwhelmed, when you feel your resources are done, I am sure there is always someone out there that will also help, someone who can give you a different perspective on what is going on. So if you've done everything according to your power, I request that you seek out for help. It could be church leaders. People here have shared their stories. You can reach out to them, and I'm sure there will be a source of comfort. You can also reach out to me. So reach out to someone else who can help you deal with that issue.
Okay. Is it only introverted people that suffer depression?
Thank you for that question. I've actually been reading about introverts of late. Being an introvert is not equal to being depressed. So it's just that introverts don't talk, may keep to themselves, but and may not be, able or willing to mix a lot with other people. But that doesn't mean that they are depressed. So someone may just be happy keeping on their own. So being introverted does not mean that you're depressed. But it's just that they may seem to be depressed because they are not talking to everyone, but that doesn't mean they are depressed. However, you find that it's even harder to find out that an introvert is depressed. Why? Because it's their nature to be quiet. So you may just think they're just being themselves. Yet if someone is a social butterfly, they talk to everyone after church, they go around talking to everyone, it's easy to notice that now they are not talking to anyone. So actually introverts at a worse disadvantage that no one may notice what's going on in their lives, and they may not want to share with other people. But even people who are extroverts do suffer from depression. And not everyone who is an introvert is depressed. It's just that so we have what we call temperaments. So temperaments actually genetically, they are genetically transmitted. So usually you find introverts have either parents or close relatives who are introverts. So that's their temperament. They prefer to be alone. They prefer to do things by themselves. They do not really socialize that much. And extroverts, on the other hand, are the opposite. But being an introvert does not equal to being depressed, and not all introverts are depressed.
And not all extroverts are free.
Yes, and not all extroverts are free.
Because me, I'm an extrovert, but sometimes I can feel low. It can happen. I don't know how to categorize it, but it does happen when you feel low. It's normal. There's a question. I think Taja will be able to deal with this. Where do you draw the line between depression, which is circumstantial, and demonic activity?
Wow, thank you, Bishop. I think for me, if I may share, in terms of demonic activity, maybe if we can look in scripture, we saw, for instance, the gentleman, Legion. Okay, I guess that those were the demons in him. That is, I would say, the example we have in scripture of somebody demon possessed. Now, and based on that, okay, like in this particular case, if you see the symptoms he was sort of exhibiting, like the Bible tells us, this was a guy, they could not hold him down by chains and all that. I cannot say for sure, honestly, that maybe that is the only way that demons would manifest. But I think for me, the question would sort of be, why, in the first place, you must understand, why are you trying to draw the distinction? Is it so that you seek the right source of help or not? So I would basically say, I think, like maybe also the doctor has shared in terms of how they even come up with sort of understanding this diagnosis. Somebody or people around that person, maybe family members, may be able to know the circumstances surrounding that particular, the way, for instance, depression has manifested. For me, in my particular case, I don't believe it was really demonic activity, particularly if you even see the way my deliverance came. Because for me, like I shared, I was just delivered. Once I got to know, I self-discovered that I was in depression. Then I just read, and the only thing I did, I just changed. I read Google, and based on what I read on Google, it was advising me, okay, try to make yourself happy. And at that time, what I did was just started hanging out socially with friends, and also try to like detach myself from the situation. So in my circumstances, like based on the circumstances surrounding, I guess, my illness, I would say I'm sure I was not demon possessed. Can I conclude based on the instances I've seen? I would not want to lie to you. It's not an area I'm an expert in. For instance, if I can just share, like my brother at night would he would shout, he would speak to him, not per se speak to himself. It's like maybe the doctors also mentioned, it's like there was voices in his head, not even voices per se, something in his head that he was hearing, and he would keep like humming. Was it a demon? I don't know. I cannot lie to you. I don't know. I think maybe it requires also more deeper discernment spiritually, but that's so far what I've seen. Yeah.
Thank you. Thank you very much. Okay, I have a boss who is always moody, never appreciated anything. He blames so much, and he's always right. Now that you are explained bipolar disorder, do you think he has one? How best can he be helped? Of course, I've had some reactions of people saying this question should not be asked. But anyway, it's here. There are people who are always negative, negative from beginning to end. They are just negative. They will never see anything positive. Yeah, and they'll blame you for everything, even when they realize they were wrong. They'll just keep going. So how do we deal with? Are they having bipolar?
Thank you for that question. So bipolar is a rather serious illness. So I think if it's just being moody, it may not necessarily be bipolar, but you see, actually, it could even be depression. So one of the symptoms, sometimes people who are depressed may not be sad, but they may be what we call moody, especially, okay, we usually say this especially happens in adolescents and younger children, but these people are always irritable. That's the word we usually use, irritable. They are, like the way maybe someone can annoy you, someone else, and then for the rest of the people, you're irritable, you're moody to them, you abuse them, but it's not their problem. So sometimes when people are depressed, they could present like that. They are moody, they are negative. Bipolar is quite a serious mental illness. These are, especially when they are in what we call the manic state. These people are not able to settle down. They are talking, they are loud, they are, if it's anger, they are really angry and violent sometimes. So I wouldn't think it's bipolar or disorder. I would think it could be a bit of depression. For some people, that's how they present. Instead of presenting as being very sad, some people are just moody, plain moody. There are small things annoy them and things like that. So it could be that. But I think for the fact that he's able to come to office every day and do things like that, may just be either a temperament problem. So their temper or their personality is like that. It may not necessarily be a straightforward mental illness, as we can see. So I'm thinking either in terms of it can be depression or it could be just a temperament problem. So what we can do with those is find a way of how to deal with them. If possible, try to keep on their right side, but sometimes it may be difficult to necessarily stay on their right side, because you may find that everything is plain annoying to them. So it's important that you do your work and stand up for yourself. In case they are oppressing you, you stand up for yourself. However, try to make sure that their bad mood doesn't trouble on you. So try to keep positive. I know at the end of the workday, you may be very stressed if you work with a boss like that. So try to see that you get some rest, and after a long day at work, to really decompress and get that out of your system. But it may not necessarily be a mental illness. It may just be a personality issue with them.
Right. Thank you very much. We have only 6 minutes to come to the end of our broadcast today. I would like to ask Deacon Taja, what are your final thoughts in today's program?
Thank you so much, Bishop. My final thoughts are basically what I've picked. It's very important to seek medical help. Like Dr. Arinda has shared, they are able, there are specialists out there who are able to work with us to be able to assist somebody to overcome. So if there's one takeaway, I would say that in case you're in doubt, or in case probably you know somebody who's going through a challenge and you are able to assist them to seek medical help, that's a good thing. But also as we pray, because honestly, God is a healer. Regardless, whatever diagnosis it is, our God is a healer. So as we also seek medical help, we trust God for the quickening of his healing and deliverance as applicable in our lives. Thank you.
Amen. Doctor, what's your final thought?
Thank you so much for this opportunity, first of all, for us to talk about this topic. But my final take home, or my final message, is that we can all get to a point where we are stressed. We can all get to a point where this stress can sometimes overwhelm us. So it's important that we seek for help when we need it. But also, as when we notice that someone has a problem like this, it's important for us not to judge them, but to accept them, because this is what will help to quicken their healing process. But I also would not want to in any way downplay the power of the word of the Lord. I know it has taken me through quite a number of hard situations myself, so I know that it actually works. And when you go to see a doctor, a psychiatrist, be open to them. You see, it's not that all the time we want to write medicine for you, but if you're able to work together with the doctor, they can actually get you ways. As I think Mrs. Chimuli said, the doctor didn't actually write for her medicine, but she encouraged her and told her to go and do some things that can help her. So that's another option that we have for managing mental illness. So do not die alone, do not die silently. Reach out and get the help, because it is there.
Well, thank you very much. Thank you very, very much for what you've shared. It's been a very, very great honor to host all of you people and to hear from you regarding mental illness. And like you said on Monday, mental illness is a continuum. Mental health is a continuum. And we all lie somewhere on that continuum. The people who turn out mad, the people who turn out schizophrenic are in the excess end. And then we have people in the middle and people at the beginning of the stage. So when you find somebody who is in that state, the best thing to do is to understand them. Don't avoid them. They will not harm you. Actually, by avoiding them, you might be adding to the problem that we are trying to solve. These are real human beings with real issues, which needs real intervention. And they say that if a person gets 14 touches a day, they may not be able to suffer depression. I've read that somewhere in the internet. If people touch them, you see today people are in social distancing, people are in homes, they're staying alone, they've been in lockdown. Chances are high that people have entered some cafes that they don't even understand. They're enjoying the silence. They don't want to pick their calls. They're beginning to hear voices. They're the only right people. They're only true people Jesus is coming for and stuff like that. Before you know it, one wire is off. Two, and then we lose the person. But when you notice a person is like that, if you can't deal with it, come and tell us. We will cancel the person. And if they accept to see a psychiatrist for assessment, we will send them there. Thank you so much, ladies. And I want to thank you, audience. You've been such nice people. Thank you for your questions. I will continue with prayer tonight. Please stand in the gap for at whatever time you have. And we continue to pray for this nation. Thank you, Doctor. Thank you, Deacon Taja. Thank you, Jean Paul Mawerere and Mr. Obeli and Minister Etienne. God bless you. Amen.
He will do it again for you. He will do it again for you. He will make a way where there is no way. He will do it again for you.
You remember the storm that Jesus spoke about, the kind of storm the builders thought was for nothing. But at last they needed a cornerstone, an unfitted the description. So they went and brought it back and fixed it there. Yeah.